Dr. Denise Ejo, the CEO of Cornwood Cancer Foundation. I would like to welcome you to our Cornwood Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
And yes, Dr. Denise Ejo will be hosting Chairman, National Committee on Cancer, Dr. Samuel Anaja Otene, to discuss how to prevent lung cancer. So it's over to you, Doctor. Good morning.
Good morning.
Good morning.
Good morning.
Thank you. Good morning, everyone. Welcome to another edition of the Kakaki Cancer Awareness hosted by AIT in partnership with Cornwood Cancer Foundation. We want to thank you once again for joining us this bright and nice morning. I think wherever you are, you want to tell us how bright it is. So I want to thank you all for joining us this morning as we start this program on knowing your lungs prevent lung cancer. Our host today, guest today is Dr. Samuel Otene. Thank you, Doki, for joining us this morning.
A pleasure.
I thank you because I tended to just disorient you just now. Sorry, I'm sorry about that.
No problem.
Welcome to this edition of Kakaki Cancer Awareness. Dr. Samuel Otene is a consultant radiation and oncology and clinical oncologist, and he is attached to ASI Comprehensive Cancer Center in Calabar. I've actually had a lot of been watching a lot of things that's going on in that cancer center. Very funny, even last night. He is a senior lecturer at Federal University of Health Sciences in Otubu, Benue State. Another thing I say, I served in Benue State. It's very nice to be reading your profile today. And the past national president of Hospice and Palliative Care Association of Nigeria and the current chairman of the Nigerian Medical Association Cancer Committee. Thank you very much for joining us and taking time out to just guide us on cancer, lung cancer. This month is Cancer and Lung Cancer Awareness Month.
My pleasure. My pleasure.
I'm going to give you some facts before we start this one. In Nigeria, according to the National Cancer Control Plan of 2018 to 2022, cancer is responsible for 72,000 deaths in Nigeria every year, with an estimated 102,000 new cases of cancer annually. That's one fact, right? 70% of cancer deaths occurring in Nigeria in developing countries like Nigeria are due to lack of access to optimal care. Nigeria is currently estimated to have 223,900 cancer cases, with 124,000 approximately new cases and 79,000 approximate yearly deaths. Okay. I'm just trying to show you some facts. When I start now, you know, there is an increase in the percentage of cancer, people with lung cancer who are living longer after diagnosis, partly because more people are being diagnosed at an early stage of the disease, and partly because a lot of awareness is going on. So with that in light, let us go. What is lung cancer? What are the risks?
All right, thank you. Well, it's easier to understand the concept of cancer when we understand the concept of the cell. I think I'll just take a minute to break that down. You see, the human body, if you break a human being down to the smallest component, what you will get is what we call a cell. We are made up of over 30 to 40 trillion cells. You know, but the funny thing is that each of these cells is able to function like it's a full living thing. So they respire, they breathe in, they breathe out, they feed, they excrete, they reproduce, they live and die. You know, in fact, they live in such a community like they respect each other. So the cells from one part of the body do not move to another part of the body just anyhow. It's like having immigrations. If you move cells from the liver to the lungs, the cells of the lungs will quickly recognize those cells as foreign and kill them. So it's a well orchestrated, community within the human body. You can imagine over 30 to 40 trillion cells. The whole world population is about 8 billion, so that's like multiplying the world population by some thousands more, but they all live in a well-coordinated fashion. Now, suddenly, for some inexplicable reason, one out of these trillions of cells suddenly begins to defy the laws of nature. So it begins to outlive its normal lifespan, it begins to outgrow its normal size, it begins to reproduce very quickly, and it now even develops an ability to move from one part of the body to any other part of the body, which we call metastasis. Now, whenever any of such occurs within the body, such a cell is called a cancer cell. Now, cancer can occur from any part of the body. When it occurs in the lungs, which are the two spongy tissues within our chest, which we use to breathe, when it occurs from there, when it starts off from there, primarily, we call it lung cancer. So I think that basically explains a little bit about what lung cancer is.
Thank you. You took it from a very different angle. I wasn't expecting that. So what are the risk factors then?
Yeah, risk factors. Well, risk factors of cancer are plenty, but the most important risk factor is smoking. Cigarette smoking is the most significant risk factor for lung cancer, whether primary exposure to cigarette smoke, that is smoking it directly ourselves, or being secondary smokers, that is living in a place where an individual smokes and inhaling the cigarette smoke when the person does smoke. Now, that is the most common risk factor for lung cancer. A few other risk factors that exist, for instance, are exposure of the chest to high doses of irradiation. So for patients who, for instance, have breast cancer and were receiving radiotherapy as a form of treatment, they would now have their chest exposed to a high dose of radiation, and they stand a higher risk of developing cancer of the lungs. Now, there are a few other things that we call carcinogens. Carcinogens are actually chemicals that increase the chances of an individual developing cancer. That is, they are cancer-inducing chemicals. A few chemicals like cadmium, like asbestos, which we used to use for ceilings. That's why right now you hardly see asbestos ceilings. All of these can easily increase one's chances of developing cancer of the lungs. There is also a factor which we have very no control whatsoever about, and that is family history. The moment somebody has a first-degree relative who has had lung cancer, their chance of developing cancer of the lungs also increases significantly beyond the general population. Maybe I should just mention radon gas also, because it's also a significant risk factor. It's something we don't talk too much about in this part of the country. Radon gas is a radioactive gas. It's produced by the natural breakdown of certain components of our atmosphere, of our environment, rocks, water, the oil and all of that, but it is radioactive. So in parts of the world where certain things are done properly, the amount of radon gas in the environment is monitored such that it doesn't go beyond a certain level. If it's beyond a certain level, one is asked not to reside in that place. But these are gases, so it mixes up with the gases in the atmosphere and people can breathe it in. So when an office or a building block is situated in a place that has a high concentration of such a gas, it means the individuals that reside there could be breathing it in and out on a daily basis, and this significantly also increases their chances of developing cancer of the lungs.
Okay, I'm going to bank that, and I may come back to that conversation, but let me just go on. Right. Can you talk us through lung cancer treatment, the options, and how to navigate it? Prevent it.
Yeah, okay. I think it's better I talk about prevention before I talk about treatment then.
Okay.
You are trying to prevent in order not to even get to the point where you will get treated, right? All right. Basically, that's why it was good we talked about the risk factors before we talked about prevention. Because when you have an idea of what the risk factors are, it it just becomes easy. You find out which of those risk factors can be modified, and you modify them. That way you reduce the chances of developing cancer of the lungs, and such you are preventing. Do not smoke. Right? That's the first thing. If you have never smoked before, do not start at all. And I think we should also begin to talk to the younger children, so that they will not get into the peer pressure, they will not feel the peer pressure, which is one of the things that drags them into smoking. We have to start telling our kids from a very young age that smoking is bad for your health. Because right now they ignore that warning that says smokers are liable to die young anyway. So do not smoke. And if you do smoke, quit smoking as much as you can. There are other options, nicotine patches and all of that do not increase the risk of lung cancer, but they could serve as alternatives. Now, also avoid secondhand smoke. So you see, the first three things I mentioned all revolve around smoking. Avoid secondhand smoking. If you have a roommate that smokes and you cannot convince that person to stop smoking, then please ask the person to go outside and smoke. And at the same time, avoid public places where smoking is encouraged. They could be bars, they could be clubs. Avoid any place where they do not publicly hang do not smoke sign. Now, when we do all of that, we significantly reduce our risk of having cancer of the lungs. I think the next best thing would be to eat a lot of good fruits, eat a good diet, which most of the time is composed of lots of good fruits and all of that. Avoid undue exposure to radiation, and probably also follow the rules of protection at work. In places where there are certain chemicals, carcinogens are easily in the environment at work, they will tell you wear a mask or something. Now, these rules are there to protect us. So we should try as much as possible to follow the rules of protection at work. Use masks, use gas masks where necessary to avoid undue exposure. Like I said, eat well, healthy diet, and try to exercise. Most of the days of the week, we try as much as possible to exercise. If we do all of that, we are significantly reducing our chances of developing cancer of the lungs. But like I said, you are only reducing the chances of developing cancer of the lungs. We cannot altogether rule out the risk, because getting a cancer is a complex interplay between environmental factors and internal factors, our genetic makeup, how we are made up. We cannot change that. So you can see somebody who has done all of these and even more, and yet still gets to develop cancer of the lungs. They have never smoked before, but yet they develop cancer of the lungs. So in as much as we do all of this, one of the other things we will really encourage is screening. We try to encourage individuals to do a lot of, to get themselves screened. You get up without feeling any symptoms whatsoever, but because you probably know you fall into a high risk category. Just the fact that you are 50 years and above already puts you in a high risk category. Just because you have a relative that has already developed cancer of the lungs, or any other cancer for instance, puts you in a position where you need to start talking to your doctor. So asymptomatically, without any symptom whatsoever, we want individuals to be able to walk to the hospital and say, "Doctor, I want to talk about cancer of the lungs. I want to get screened." That way, we could do what we call a low-dose CT, a low-dose computerized tomography, and that would help us to detect the presence of minute cancer cells in the lungs, even when they are not big enough to start causing symptoms whatsoever. Now, this was supposed to be a prelude to treatment, right? So maybe I should go on. All right. So maybe I should just quickly say that there are various treatment modalities that exist, and each of them is applied to the patient based on so many factors, based on how the patient comes in, based on the stage of the disease, and also to a large extent based on the preference of the patient for any treatment, because some patients could simply hear all the treatments and decide, no, I do not want any of this, So we have surgery. Surgery is a treatment, taking the patient into the theater, cutting out the tissue with a knife and all of that, trying to extract all of the cancer tissue out of the lungs. Surgery is one of the oldest systems. It's actually one of the most reliable of the systems. But again, we have radiotherapy. There are some patients that will just not be amenable to surgery, and we use radiotherapy. That is use of ionizing radiation to ablate, to kill the cancer cells in the lungs. There is also chemotherapy. chemotherapy is use of drugs, use of chemicals. They are injected into the patient, or some of them are swallowed. But what they do is to target cancer cells. Remember, I said that cancer cells are highly reproducing. So you use chemotherapy agents, which are drugs that target highly reproducing cells within the body, and these are likely to be cancer cells, and that way they are able to help reduce or eliminate the cancer cells. But mind you, there are so many other cells in the body that are highly reproducing naturally. Cells in the bone marrow, cells in the gastrointestinal tract, that's our feeding tract, and all of that. So while the chemotherapy agents target these highly reproducing cancer cells, there is always that tendency that they could also target the normal highly reproducing cells, leading to so many side effects. Now that I'm mentioning because that is what led to the fourth modality of treatment I'm going to mention, which is what we call targeted drug therapy. Now with targeted drug therapy, what is done is to get a little bit of the cancer tissue, the lung cancer tissue, analyze it in the lab, and have some idea of certain characteristics it has that differ totally from other cells within the body. So that characteristic now forms a target, and it can be targeted specifically. That way you're able to kill the cancer cells and not harm other normal cells within the body. Maybe you should add something like immunotherapy, because our body normally has an immune response, but for cancer cells, somehow the cancer cells just have a way of down-regulating our immune system, and as such evading all the normal checks and balances the body's immune system has for prevention and for protection. So what we can do with immunotherapy is to modulate the body's immune system upwards, and when we're able to do that, we are able to help the body itself to fight against various sorts of cancers, lung cancer inclusive. Then there is stereotactic body irradiation. Now that is still like radiotherapy, but it is a little bit different, because in fact they call it radiosurgery. Because with radiosurgery, what you're able to do is to use different rays of radiation, highly ionizing radiation, but they are focused from different points on a particular part of the body where the lung cancer is. That way you are able to feel better, increasing the quality of life, even when you know that you are not able to totally eliminate the disease from the patient.
You just helped me to really not summarize, but actually give the facts, which is what we want. It was so interesting. There's one I really didn't get, but at least I can say I've been through, I think, all of them, except whatever that your last one was. That, I don't know, I was trying to say, is that similar to a gamma knife surgery?
Precisely, yeah. Stereotactic body irradiation.
Okay.
That way people call it is gamma knife. That's why I said it is also called radiosurgery. So other people call it gamma knife surgery. Yeah.
Okay. You see now, just imagine I've done every step, every single one you just talked about, and I'm still alive. So all those people dead for battling cancer, 6 years on, I've done all, and I'm still there. So please just follow instructions and do the treatment. The doctors are telling us.
I'm working for you right now.
I was trying to work it out. I recognize this one. I've done this one, but I didn't get the last one. So it's gamma knife surgery. All right, I'm going to ask you one more. Another question. It says, what does prognosis? You see this word? You are medics. You guys use this word prognosis all the time.
Yeah.
And even me, sometimes I struggle because I don't like looking at dictionary. What does that word mean in cancer?
Okay. Now, prognosis is like trying to give yourself an idea of where you are headed to, even before you set off on the journey. Now, so prognosis is like trying to have an idea of what are the possible outcomes for this patient, even before you start. It's like saying you've seen a patient, given the stage of the patient, given the disease the patient has, given the statistics that are available, you have an idea, any patient that comes in with this stage of disease is likely to probably live this long, or is likely to get cured, so prognosis is like from the beginning having an idea of what are the possible outcomes for this patient. Is this patient likely to get cured? Is Is this patient not likely to get cured? Is this patient likely to live for another 6 months or 5 years or 10 years or 20 years? And it's all based on statistics. So most of the time we see patients that will tell you, well, the doctor gave me 6 months and I'm still alive. This is the 7th month. It's all based on statistics. The doctor is simply saying, well, if 100 people that have been seen with this disease are at this stage, let's say this percentage of them is likely not to live beyond this age. Now, because it's a percentage, and percentages are based on things like mean and modal values and all of that, there would always be outliers. So you could always get a patient who falls on the extreme on the low side or on the extreme on the high side. But basically that is prognosis. Prognosis is a doctor sitting down to give an idea of what the possible outcomes of a disease are likely to be based on the facts at his disposal at that point in time.
Thank you. So with that, we're also saying to everybody, whatever your prognosis is, always be wise. Listen, ask the questions. Don't let non-medics advise anybody on what to expect, because we have a chance of saying what is wrong or thinking that the doctors don't know what they're talking about, and they do. And it's not necessarily a hard fast rule, but prognosis helps our cancer patients to know how to navigate life's journey going forward. That's what I think it does. But okay, as a nation, and you see this out in Nigeria, we have to love our country like that. As a nation, give me 3 priorities that we need to support cancer patients and the cancer survivors. Okay, let me use the word cancer survivors because I don't really like the word cancer patients. But 3 priorities that can be done to help support cancer survivors.
Patients, okay. Cancer, well, those within the cancer space. Well,
all of us that are, me, I always say all of us space. No exemption. You see, there's no respect for the cancer doesn't respect anybody. So all of us in this space.
Well, maybe we should just break it down. And since you said 3, we should break it down into before the cancer, during the cancer, and then probably after cancer treatment, right? So before the cancer, I think the priority should focus on enlightenment, on education. We should get people to know better. We should get people to know better about cancer so that we can encourage people to screen, because the hope of curing a patient depends on the stage at which a cancer is caught in that patient. So if more people know about cancer, more people who are totally asymptomatic, do not have any problems whatsoever, get up to go to the hospital and say, doctor, I want to get screened for breast cancer, I want to get screened for cervical cancer, I want to get screened for lung cancer. Well, that would help a lot. So that should be a major priority. Encourage awareness, encourage people to screen. For treatment, it's a whole gamut of, it's a big basket of so many issues, but I think there should be far more cancer treatment centers, well equipped to diagnose, well equipped to manage, well equipped to treat. If the World Health Organization is saying that we need over 200 radiotherapy centers in Nigeria, and Nigeria as we speak does not have up to 10, out of which less than 3, 4, 5 are functional at the same time. Thank God for private centers like the one I'm sitting in right now, which are usually functional. Otherwise, hardly any government center is functional at any point in time, and you need over 200. That is a problem. That should be a priority.
Okay, thank you. You've given me the 3 and my time is up. So I need us to finish. You gave me 3 good ones, and I want to say a very big thank you to you for this. Thank you to AIT for this opportunity for us to talk about cancer. Next month we'll be looking into Christmas. Let's look at what God has done for all of us, cancer survivors, and those that are not, but those who are carers, and looking at what is going on in the cancer space. For you to have an idea of what's going on, you can follow us on Cornwall Cancer Foundation. You can share, you can subscribe, you can click to get notifications of whatever we're doing. And everything we do is on our Instagram page, we've got a Facebook page, we've got a website, and our LinkedIn and YouTube. So you've got quite a lot of spaces where you can find, but it's Cornwall Cancer Foundation. .org is our website, and you should find a lot of information. I want to say a very, very big thank you to you, Doc, for taking time out. And please tell your patients that we really appreciate the time. I know they would have been waiting for you now. So thank you for joining us, and thank you for helping us to work through this. We're really, really grateful.